Hello, I'm Peter Mark Fortune. I'm a consultant paediatric intensivist based at Royal Manchester Children's Hospital and also chair of MIST, the Making It Safer Together Paediatric Safety Collaborative. And I'm going to talk to you today about human factors and how they come to play at the time that a child's deteriorating or unwell under your care. First and most importantly, I want to make the point that recognising deterioration in a child is simple. We look at them, we put together what we've actually found and we recognise what's going on, and then we escalate as appropriate. And that might be by intervening and delivering some care, or it might be by calling for help, depending on the situation. So what can go wrong? Well, what can go wrong is that we're human beings. So human beings are fallible. Human beings make mistakes, and there is no way of getting away from that. We all do it. And with the best will in the world, it's impossible to stop that altogether. What we can do is understand some of the mechanisms that goes behind those occasions that we make the mistakes. And by recognising where things are going wrong, we can stop things in their tracks and hopefully prevent a mistake turning into harm to a child. So the context of this is really, really important. When we come to work every day, we all come in to do the absolute best that we can. We come in to look after every child and get them back home at least as well as they came in, and hopefully way better than when they came in. That's our goal. So what goes wrong? Well, human factors recognises the fact that often when things go wrong, it's because at the time it seemed right. And so you proceeded down a particular path because that seemed like the right thing to do. And this pivots on something called situation awareness. Situation awareness is a concept where when we enter a scenario, so particularly a room with an unwell child in it and we're coming to care for them, we're assembling a whole stack of pieces of information like pieces of a jigsaw puzzle. And what we do is we put them together to assemble a map of what's actually going on. And that allows them to understand where they are at the current time, but also project forward and make appropriate plans to go into the future and give the right care to the child. Obviously, right at the beginning, there are often gaps, or even later on there could be gaps as well. And it's important that we spot those gaps and that we look to plug them along the way. But it's also important that we assimilate any other new pieces of information that we may not be expecting, if you like, and fit it into the puzzle that we're trying to assemble. And I'll come back to this particular scenario as I go on in the talk. The other thing that's important is even when we think that we have the whole situation, sometimes there can be some sort of blurry bits or things we're not quite sure about, and you have to look very closely. And I think of this example of the picture of this young lady. So if you were asked to describe this picture, your first words maybe it's actually quite blurry. And so we can sort that out and bring it into focus. But actually, there's still something missing. So if you were describing this young lady, it'd be nice to actually say she's got pink glasses on. So there was a little bit more information that wasn't entirely obvious that it was missing. And again, that can be one of the things that can really throw you in fully assembling good situation awareness. The last bit is to listen of all the information that's coming in from everybody that's feeding it in. So Maya, who very kindly lent me her jigsaw to put together the slides for this talk, has got that missing piece for us. And the important thing about picking her out is it could be anybody in the room or anyone involved with the care of the child that holds that missing piece, no matter how junior, no matter how non-medical or general their background. So listen to everything and try and assemble those pieces into the overall picture. What I want to do is look at situation awareness, particularly in the context of the child who's deteriorating. And I want to focus on early warning scores, something called fixation and confirmation bias. I want to think about our interactions with colleagues and also talk about the times when things don't quite make sense and potentially even we're a little bit confused. So with the early warning score, this will be very familiar. A child presents in the emergency department and a nurse actually does the initial assessment of the child, does the observations, but may note along the way that the child has got an unusual rash, this one looking somewhat like a meningococcal rash. Quite naturally, the nurse will be concerned by this. She then goes to actually do the scoring and work out the early warning score and finds that it's very low, and therefore things are okay. Well, clearly they're not okay, so what has gone wrong? Well, what's gone wrong is a tool has been used in the wrong way. An early warning score is exactly that. It is about warning. It is not about reassurance, and it mustn't be used in that fashion. It must only be used as an early warning score. So tools, clinical tools, must be used in the right way. That's very, very important. Fixation and confirmation bias is another feature that we see. Not uncommonly, we will be in a chain of people actually delivering care to a child, and it's quite possible that a diagnosis is handed over to us at the point that we receive the child. So a child coming into hospital from the emergency department, for example, a baby, might be presenting and shared with us as having a chest infection. As more information becomes available from lab results and from the X-ray, it may be that what we actually have is information that challenges that. So a white cell count that isn't raised, no changes on the X-ray. So the information really doesn't fit with where we actually started. We're very good at making it fit because we've got that diagnosis, and the most important thing when you've got something that clashes is to start again. So re-examine it, think again, start at square one. Be very ready to throw out your presumptions and that diagnosis that was handed over to you, even if it was someone senior who you have great respect for, because they didn't have the information that you've now got. That's important. So think again. The other situation, which is very similar to this, is in the pressured and busy environment. Sometimes information can be coming at you at just a rate that's very difficult to absorb, or that actually you feel quite alarmed by at the time. And it's kind of easy to look to one side and try not to look at it because actually it's going to take more of your time, which you haven't got, or it's scary. Well, please don't do that. It's really, really important that every new piece of information is looked at carefully. Don't discard anything or ignore it, because it's necessary to build that correct picture to do the right thing for the child. Much of what we do when we're looking after children is working with colleagues on that. We're always part of a team along the way. And in conversation with colleagues, I know I not uncommonly find myself wondering quite why they came to talk to me about a child on a particular occasion. And that should be ringing a little bit of an alarm bell with you, because they will have had a reason behind it. And I've just listed a set of questions here, which I would recommend you run quickly through your mind at any communication point. So why have they rung me? If it's not clear, ask them. So if you've talked for a while and you're not sure what their worries about, say, what is it that you actually needed from me? Why are you worried? You need to understand that to make sure that you've got the right information going backwards and forwards between you. If they're describing a child to you, check their situation awareness. Have they got all the key information, or is there something that's missing, something you might be able to augment through experience and ask them to look for? And if you give advice, make sure that they understand what you've actually said to them and have taken that on board and understand the plan. And I could have talked for the whole 10 minutes about communication, but I just want to nail a couple of points there in discussing these conversations. And that is that it's a two-way process. It's about listening as well as talking. But more importantly, it's about closing loops. So in the process of communicating, we actually summarise back to one another things that we've said, we confirm the content of it and put it in different words. And actually using a structure like SBAR or SBARD is something that can add an awful lot to that, because it's a familiar structure that everybody can actually latch into. Finally, on the main issues of human factors, confusion. So sometimes, as you look at that picture, you're looking at the assembled jigsaw puzzle, you realise that it doesn't make sense to you. That, in human factors speak, is a massive red flag. That's an occasion where something is screaming at you that your situation awareness is at fault and you don't quite have the right picture. So always, always discuss with somebody, always go and try and find the missing piece. Always escalate if that's what's needed to somebody with greater experience. On top of all these factors that we've talked about, other pressures come to bear on us in the clinical environment. And I think the most obvious one is anxious or demanding people who are asking questions all the time. They're asking them with exactly the right motivation. They're advocating for the child. They're trying to make sure that the child's safe. But it can turn into the sort of cry wolf situation, particularly where there's multiple false alarms, where you can tone down your own response if you're not careful. And this can be brought into very sharp focus sometimes by anxious parents who are just asking a lot of questions and pushing very hard because of their fears for their child. These are things that one needs to be very conscious of so that one suppresses them and makes sure that every single time a new piece of information comes forward, it's treated just fresh. It's treated so that you give it a fresh look and you're not coloured by what has gone before, because it might be the occasion where the child's deteriorating and actually needs an action for you to sort things out. And finally, pulling it all together, I want to talk very briefly about leadership. Many of the children that we look after are really quite complicated and will be under the care of multiple allied health professionals and doctors and nurses and physios, all sorts of people. And the problem there is that sometimes someone doesn't actually have the overall picture of what's going on. They're all focused on their own little corners of what's going on. The right big toe specialist here at his computer focusing on that. What we need is that person with an overview, because that's the person that looks at everything that's going on and might just see the pattern that this child is getting into difficulty. So that's an important component of any team at any occasion, that you've got a clear leader in there. So I'd just like to summarise. Looking after and spotting the deteriorating child is easy. We look at them, we recognise what's going on and we respond. But there's some really important caveats in there. If you're worried, talk to somebody or escalate. If a conversation or handover isn't entirely clear to you, then ask again, get it clarified. That's really important. And if it's you that's actually being asked for advice, then it takes that little bit more as well. You need to listen, you need to understand, and you need to support that individual. If you'd like any further information on any of this, you're very welcome to contact me on the email address shown on this slide. There is also information on both the MIST and ALSG websites around human factors, and both of those organisations also tweet regular safety information. Thank you very much.